The next speaker is Dr. Mina Popovic. Dr. Mina Popovic is a clinical embryologist with expertise in genetics and scientific director of the Eugin group in Barcelona. She is also a professor at Ghent University, co-director of Master in Human Assisted Reproductive Technology at Pompeu Fabra University and Business School of Management, and past coordinator of ESRE's Special Interest Group Stem Cells. She holds a PhD from Ghent University, where she studied chromosomal instability in early human development, and she has extensive experience in embryo genetics, PGT, and stem cells biology. Previously, she worked as a senior clinical embryologist and regional program laboratory manager at Genea in Australia. Today, Dr. Popovic will show us the Eugin's experience applying the Kitazato ultrafast warming protocol on human oocytes and embryos. So please, Mina, go ahead. It's your turn.
Thank you very much, Andreu. Thank you for the introduction, and thank you to Kitazato for this invitation. It is really a great opportunity to be able to share some of the work that we have been doing with the ultra-fast warming protocol, both for oocytes and for embryos, so for blastocysts in particular. And what I really like to emphasize is the fact that we have been able to perform both preclinical and some clinical applications of this protocol. So at Eugin, we always emphasize the value of translational research, and we started the validation of these protocols in this way. So it's really a pleasure to be able to show some of this and share some of this work with you. And thanks also to Miguel for doing such a nice introduction of all the technicalities. So I will focus more on the specific results that we have. But one thing for sure that to mention is that, of course, vitrification and warming really represents a significant and increasing workload in the IVF lab. I'm sure you will all agree with me. And of course, its widespread use has led to a lot of nice opportunities and greater opportunities for patients of varying family planning needs. It has improved also safety and effectiveness of IVF treatments. But what we know about the conventional multi-step warming protocols is that they are effective, of course. As we mentioned, they have improved safety and effectiveness, but they are also labor intensive. And it's not even so much about the timing, even though we can say that they do take more than 10 minutes for oocyte or for blastocyst, but it also involves multiple steps. And these can, of course, lead to procedural inconsistencies during the vitrification and the warming, and also potentially lead to more variability amongst operators. So for this reason, the newly proposed one-step ultra-fast warming protocol it aims to improve this efficiency, and it in fact takes just 1 minute. So far, there have been this one-step protocol has been introduced, and actually it's very interesting to mention that several years ago it was actually implemented in animal models and shown very satisfactory and promising results. More recently, the group of Dr. Lieberman and colleagues also applied this protocol and showed satisfactory results when warming blastocysts and also oocytes. So as we have heard also from Miguel, when we talk about oocytes, of course, they represent a more complex challenge, and more validation may in fact be required for implementing this protocol. In this presentation specifically, I will be focusing more on warming, but it is important to mention that some of the first work that was done in human oocytes recently demonstrated by Lieberman and colleagues, they actually looked at oocyte survival rates and resumption of meiosis in human oocytes when applying both rapid vitrification and warming procedures. But what we have to keep in mind is that millions of oocytes have already been vitrified using conventional methods. And few studies to date have actually validated rapid warming following a conventional vitrification protocol, especially at the level of clinical outcomes. So this is where we believe that further research was needed before widespread application, and this is what we focused on. A few studies just to mention here, as we're already talked about, from embryo tools from Dr. Nuno Costa Borges, the first study. These were both actually presented at ESHRE last year. These were specifically related to oocytes. And what they showed was that the ultra-fast vitrification and warming, in fact, did achieve similar results to conventional protocols and improved efficiency. However, this first study did not really use a sibling oocyte design, which was one of its drawbacks, but still very promising results. And we will hear more about this in the next talk by Birol, but I just wanted to mention also their study where they looked at ultra-fast vitrification and warming and showed that it preserves oocyte viability and also embryo quality. They employed a sibling oocyte design, but what is here to mention that at least in this study that they presented, they looked at rapid vitrification and warming in association. So again, this limits a bit the scope of the findings because they did not start with a conventional vitrification method. So in terms of what we are trying to apply clinically, we really wanted to focus on oocytes that had been frozen with conventional methods, but thawed with the ultra-fast protocol. And for the protocols themselves, just to give a bit of an overview, so the conventional warming is what you would be generally used to. So it's a series of steps through a thawing solution, dilution solution, washing solution, and then transfer to the culture media. And the ultra-fast warming really is just 1 minute in the thawing solution, a hold in washing solution, and then transfer to culture media. So for the first step of the preclinical validation, we focused on mature oocytes. These were obtained from oocyte donation cycles, and this was a small study of 56 oocytes that were vitrified using the conventional protocol. They were donated to research as they were not suitable for clinical use. So we thawed them using the ultra-fast protocol, and we assessed survival rates post-warming. And for half of the oocytes, in fact, we also performed a sham ICSI injection just to look at the cytoplasmic integrity and survival post-injection. And we compared these results using a propensity score matching to outcomes of oocytes that were warmed using the conventional method. And as you can see, the survival rates were comparable amongst the two groups. So around 94% for the ultra-fast warming and the conventional warming. When we look at the outcomes of the sham ICSI injection, in fact, 22 out of the 23 oocytes survived and maintained the cytoplasmic integrity 24 hours post-injection. So this was very reassuring to us to continue with clinical implementation. So for the clinical implementation, we actually performed a prospective sibling oocyte study. So this was again, included 101 oocyte donation cycles. These were ICSI cycles that were performed at a single center. And what we in fact did is that we took cycles that had at least 3 or more cryotops that were vitrified. And one of the cryotops was thawed using the ultra-fast protocol, and then the remaining cryotops were thawed using the conventional protocol. So in total, 818 vitrified mature oocytes were warmed, and we could follow up the outcomes of these two different protocols. So for the ultra-fast, we had around 250 oocytes, and for the conventional, around 570 oocytes, and we followed up the survival, fertilization, blastocyst rates, the quality that was routinely evaluated. And we also followed up on the transfer following these thaws. So following the culture, the blastocyst transfers, the single embryo transfers, 89 transfers, 37 for the ultra-fast, and 52 for the standard. So this allowed us to directly compare the implantation and clinical pregnancy rates between the embryos. So in terms of developmental outcomes, overall, we saw very good survival rates across both protocols, so close to 94%. Fertilization rates were also satisfactory, and we saw no difference between the two protocols. What was interesting is that we did see a significantly higher blastocyst rate following the ultra-fast warming, and we are looking into this further. But what we can say is that in terms of good quality blastocysts, we saw no difference amongst the two protocols. And when we look at the clinical outcomes following the transfer of the blastocysts that were derived from these oocytes, we see no difference in terms of implantation or clinical pregnancy rates. So overall, what we observed was that this ultra-fast oocyte warming seems to offer a time-efficient alternative to the conventional protocols, that it did streamline our laboratory workflows, and that wider adoption may enhance patient care just by improving the efficiency of the IVF laboratory. So for our next step, we also wanted to apply this protocol to blastocysts and blastocyst warming. And again, we performed a preclinical validation. In this case, we actually used our optimized in vitro culture protocol that allows us to culture embryos beyond the implantation stages, so in fact, up to day 12 of development in vitro. So we can actually plate blastocysts at day 6 of development using this protocol, and we can culture them. They form these outgrowths, and we can keep them in the lab up until day 12 post-fertilization. And when we stain them, we can see that these outgrowths do resemble what we expect from post-implantation or early post-implantation development. So we used this in vitro system or assay to actually look at the developmental outcomes following ultra-fast warming. And for this study, we used a total of 225 PGTA blastocysts. So we actually had the chromosomal status of these blastocysts as well. And over 100 embryos were thawed using the conventional multi-step warming protocol. And as I said, we knew the chromosomal status. So around 99 embryos had uniform aneuploidies, so trisomies or monosomies, so gains or losses of chromosomes. We had some euploid embryos as controls. And around 100 embryos were thawed using the ultra-fast warming protocol. Again, 91 uniform aneuploidies, uniformly aneuploid embryos with trisomies or monosomies, and some euploid embryos as controls. And the first thing, of course, we looked at was the survival rates of these blastocysts, and we observed a very good survival rate for both protocols, so around 98%, and no difference between the two protocols. When we look at it in terms of the developmental outcomes, we first assess the attachment rate. So when we look at the multi-step or the conventional warming protocol, around 50%, or in fact 50% of the embryos attached, and they progressed to day 10, whereas 50% detached. And we had similar outcomes for the ultra-fast warming protocol, 57% attached and form outgrowths and developed to day 10, whereas around 43% degenerated and detached. And when we further correlate these attachment rates to the blastocyst chromosomal profiles, we observed overall that euploid and trisomic embryos were significantly more likely to attach, but we don't see any differences in terms of the way in which they were warmed. So we see comparable viability and attachment up until day 10. The monosomic embryos were significantly more likely to detach, which we have also continuously seen using this protocol, but again, no difference between the multi-step and the ultra-fast warming. So this was, again, very reassuring to us. And for this reason, we continued with the clinical validation and implementing this protocol clinically. So far, we have thawed or warmed with the ultra-fast warming protocol are a bit over 800 blastocysts. And we compared these overall to the outcomes of blastocysts formed using the conventional warming, thawed using the conventional warming protocol. So, and in fact, both of these groups followed identical laboratory and clinical protocols. And the choice of the warming method was determined by the time period. But we also did a propensity score matching to compare the outcomes following these two warming protocols. And we also looked at frozen embryo transfer outcomes following the transfer of 719 blastocysts warmed using the ultrafast protocol and 1,829 using the conventional warming protocol. So when we look at the differences between these groups, they were very much comparable. So in terms of maternal age, the number of natural frozen embryo transfer cycles, day of transfer, good quality blastocysts, and even the survival post-warming was comparable. So when we look at the two groups, really a really good survival rate, regardless of the protocol, over 99%, and no differences again between the two protocols. When we look at the clinical outcomes, we had comparable clinical pregnancy rates following both warming protocols. For the implantation rate, it was interesting that we observed a significantly higher implantation following the ultrafast warming. We are still looking into this, and it seems that as we increase the numbers, this is not significant anymore, but they are comparable. So similar to the clinical pregnancy, and we saw no difference in terms of miscarriage rates or ongoing pregnancy rates so far. So overall, these results are very encouraging to us. And we can see that the ultrafast warming protocol seems to be as effective as the conventional multi-step warming for blastocysts and also for oocytes in terms of survival, for the blastocysts also in terms of the in vitro developmental outcomes, so the more immediate effects, but also in terms of clinical outcomes, so the clinical pregnancy rates. Of course, as we've already mentioned, this reduces the unnecessary time that blastocysts and oocytes are exposed to room temperature, and it also may reduce some of the variability amongst the operators from moving the oocytes or the blastocysts through all of these different media steps. And of course, we think that the ultrafast protocol may enhance the efficiency of IVF laboratories, and in doing so, improve the patient experience and improve patient care. So finally, I would just like to thank our R&D team who assisted with this research. Also, Maria Jose Zamora, who is the lab director at Eugin, Barcelona, and also our collaborators on this project from CEGIR, part of Eugin Group in Argentina, and also our external collaborators from Boston IVF. And thank you very much for your attention.
Well, thank you very much, Mina, for sharing your experience with the ultrafast warming protocol. Congratulations also to the whole Eugin team for this fantastic work. So many thanks.